Hi, it's Dr. Eric Robbins talking to you from Los Angeles. And tonight what I wanted to do is explain a little bit more about mind-body healing and what it is. And it's something I've been using in my medical setting for close to probably 20 years. So as some of you may know, I co-authored a couple books on energy healing. And people are always saying to me, Eric, why are you talking about all this esoteric energy stuff and chi and it sounds so weird? So let's get something straight right from the beginning. First of all, when I talk about energy, all I'm referring to, it's not some weird esoteric thing. What I'm referring to is, when you wake up from bed every morning, you know how you feel. You have a feeling of well-being inside. You have a feeling of energy. You either have a get up and go, or you feel like you got up on the wrong side of the bed. So whatever it is, your general feeling of energy, how full your tanks feel, how motivated you are to do stuff throughout the day. If someone asks you to do something, are you up for it? Are you pretty tired? Do you need some downtime? So when I talk about energy, that's one of the ways that I represent it to myself. Basically, all of us are bathed in the same energy. It comes from the air we breathe, from our food, from the ground, from the sun. And so if all of us are bathed in the same energy, then how's it possible that some people are chronically fatigued and some people are sick a lot? And that's going to be one of the things we talk about in this video. Now, interestingly, I'm a urologist, and so a lot of people come to see me, and they don't know that I do all this mind-body stuff. And so when I'm seeing clients in the office, and I think that they benefit from some sort of alternative healing modality, I have to tell some stories or metaphors so that I get them to kind of understand what I want to do with them. And the key thing as a mind-body guy, you don't want the client leaving the office, the patient leaving the office, and saying, man, the doctor just told me the problem's all in my head. So this is a very quick metaphor that I tell patients that kind of shifts their understanding of what we're going to do. And I say, if someone has a stomach ulcer, they've got a hole in their stomach. I say, if you look down there into their stomach with an endoscope, they've got a hole in the stomach. So that's literally as physical as it gets, right? And the patient says, yeah, that's right. And then I say, but if you jump up a level and you ask, gee, why do they form that ulcer to begin with? Then you might say, well, the patient's body was making too much stomach acid and it burned a hole in the stomach. And that makes sense, right? And the patient usually says, yeah, that's true. And then I say, yeah, but if we jump up another level and ask, why was the body making too much stomach acid? Then, you can understand that sometimes stress or negative emotions or things that we're worried about cause physical changes in the body that end up forming a physical problem. So again, the key thing to understand if you see a mind-body expert is that it's not a matter of the problem's just in your head or that the client's crazy, you're making it up. Mind-body issues means there's things that are happening in someone's life that have happened, some type of memory, some type of belief system that leads the body to make physical changes that ends up being an illness. And conversely, what I used to think about for years is the idea that, gee, if someone's had a past trauma that's held in their body, at least in theory, if you could have a way of clearing the emotions at a deep enough level that maybe the body would heal itself. So that used to be a theory until I discovered kind of the trifecta of healing modalities that I now use. These days I use a combination of hypnosis, of NLP, which is neuro-linguistic programming, and of EFT, which stands for Emotional Freedom Technique. And EFT is basically a form of emotional acupressure. And actually, most recently, what I've gotten involved with is a guy named Robert G. Smith, and he developed something called fasterEFT. If you go to his website at fasterEFT.com, you can read all about it. But what I love about Robert is that he synthesized and integrated the best of hypnosis, NLP, and EFT into a very usable system. It's incredibly fast. I've been using it in my clinic now for a few months, and the speed and depth of the changes are just blowing me away. So he literally teaches somebody like me, I'm not a therapist, I'm a surgeon, teaches me how to approach patients, how to think about patient problems, and then how to work on the issue. So when patients come into the office, I give them that ulcer metaphor, and that kind of is a way of very rapidly shifting their thinking so they realize, it's safe to work on my emotional issues, and Robbins is not saying the problem's all in my head. So by the way, that ulcer story is just an example of something that we call higher level thinking. I remember a few years ago I heard a story that these guys were down fishing at the side of the river, and all of a sudden they look in the water and there's somebody slashing around and drowning in the river, and one of the guys puts down his rod and jumps into the river and with a great effort drags this guy out from the rapids and resuscitates him. And just as he's pulled that first victim to shore, his buddy looks out and there's two more people that are sloshing around and drowning in the river and getting pulled under the rapids, and him and another bystander jump in, and with great effort they drag these two victims out. And just as they're getting them to shore, another two, they look in the water and hear screams, and there's another two victims in the water. And this goes on and on. And the point of the story is, if these two fishermen had bothered to look about a block upstream, they would have noticed that there's a bridge going over the stream, and there was a bus that had been stalled on the top of the bridge, and there was this crazy guy taking people and pulling them out of the bus and throwing them in the river. And so the question that raises is, at what level do you deal with this problem? You could keep pulling people out of the river all day long, or you could go upstream a little bit, notice what's a higher level problem which is causing this situation to take place. In this case, if you take care of the crazy guy who's throwing people off, that would be dealing with the higher level problem. Then you're not going to have to keep pulling people out from the rapids. So that's an idea of higher level thinking. When we do mind-body healing and holistic healing, we like to look at patient problems and patient diseases. A lot of standard medicine, they look at a patient, he's got a disease, they give that a label like hypertension or irritable bowel syndrome, which, by the way, makes it seem like you're kind of stuck with that. As mind-body expert, I'd like to look at a disease and ask, what else is going on? Like, why would this patient have this disease? What else is going on in his life or her life that is blocking the flow of the body's healing energy and manifesting as a disease? One of the things that I found over the years is that when someone's had a past trauma, something's going on in their life, there's a past traumatic memory, there's a wartime memory, or someone could have been molested as a kid, or any huge number of traumas. Most of us have had them. I've had my share. And the thing I always tell patients is that whether we like it or not, traumas are held in our body. And because frequently it's an event that we don't like to remember, it doesn't feel good, we hold those memories and the emotions inside our body, okay, so that we keep them outside of our conscious awareness. And what's required to hold these memories and feelings in the body, the organs and the muscles have to clamp down to hold the emotions inside, to keep them from coming up to our conscious awareness, because we don't want to think about them all the time. And the problem is that takes a tremendous amount of energy to constantly be holding these memories and bad feelings in our body 24 hours a day, 7 days a week. One of the things we notice is that some people have been holding memories in certain muscle groups for so long, sometimes their whole life, that Dr. Reich, R-E-I-C-H, called this Reichian armoring, that sometimes the muscles just get so fixed and tense from holding emotional issues there that a person's whole posture can change based on that. From an energy standpoint in general, it's these chronically tense muscles and organs that block the flow of the body's healing energy, that block the flow of the chi, and that lead to disease and lead to a lot of things that we call diseases and illnesses. What I would tell you is, using some of the modalities that I'm talking about in this video, listen clearly. It's possible to clear emotional issues at a deep enough level that physical healing results. And I'll give you a perfect example of how we use this, because again, this is my purpose of this video is to speak to you so that whether you're an MD, whether you're a PhD in astrophysics, whether you're a custodian somewhere or a garbage collector, I'm trying to speak in plain English and really break down mind-body healing. It's not actually particularly complex. So I'll give you a case that I had not too long ago. We had a woman who had severe pelvic pain. She had vaginal pain and spasms. She had some bladder issues as well. One of my partners saw her and did the full urologic workup and couldn't really find anything that was obviously anatomic out of the picture. But again, the issue is not whether this problem's in this woman's head. The issue is that this woman's pelvic floor muscles were tight and spastic. And my partner knows what I do, so he elicited from the patient that indeed she was molested at age 5. And he sent her to see me. I was thinking, this trauma may be held in her pelvic area. She was molested, so that could be an area where this trauma is held in her body. And at least in theory, if we can clear the trauma, maybe we can get some physical healing. So this woman came to see me, and I said, when you think about the molestation, how intense are those emotions from 0 to 10? She said they're a 10 out of 10. I said, where do you feel them in your body? And I think she felt them in her gut or somewhere like that. I said, think about that event. We tapped on certain acupressure points while she was thinking about it. And literally, after a few minutes of tapping, she could think back to the event. She could feel no emotional charge in her body. I mean, it literally felt to her like if she thought about brushing her teeth that morning where there's something where there's no emotional charge, that's how it felt to her. So we literally cleared the trauma off of that event at a body level. She left the office that day. I gave her instructions for how to continue to do some tapping on certain acupressure meridians at home. She went to the fasterEFT.com website. Robert's put up 500 free videos on YouTube that are categorized on his website. And she did a lot of tapping on herself. And she came back to see me a month later, and she was in tears. As it turns out, all of her vaginal pain, bladder dysfunction was better. She was able to have sex with no problem. In fact, we joked that she was driving her husband crazy because she's chasing him around the house for sex all the time to make up for lost time. So that's a very clear example of what can happen with this work. What I would suggest to you is that the vast majority of problems we see in the office are related to how we process our emotions. Robert Smith is fond of saying that, you know, our brain's up here, but our mind is not here. Our mind, or what we otherwise refer to as our unconscious mind, is felt and represented by the body. So the mind is the body, and the body is the mind. Meaning if someone has some issue going on in their body, there's usually some sort of issue with how they're processing their emotions. So, you know, the whole gamut of musculoskeletal pain, back pain, neck pain, shoulder pain, butt pain. For example, what Dr. John Sarno, who's a professor of physical medicine at NYU, showed is that the vast majority of musculoskeletal pain, regardless of what findings are found on an MRI scan. So what Sarno would say is that the majority of cases of back pain are due to chronic muscle tension and spasm. Even if a person has an MRI scan that shows a slip disc or spinal stenosis or spinal arthritis, Dr. Sarno says that's not the cause of the pain. Sarno said that because he'd say, you know, if you have a group of 100 middle-aged patients who come with back pain and you do an MRI scan on them, 65% of them will have a slip disc or spinal stenosis and they're not having pain. So the majority of types of musculoskeletal pain are caused by chronic tension and spasm of the muscles. By the way, that causes a very real pain. You can imagine a muscle in your back being chronically tense and spastic. The blood can't flow into that muscle because of that as easily. There's a relative lack of oxygen, and that causes a tremendous pain. The higher level question we ask, though, is why would someone have chronic tension and spasm of the muscles of their back, neck, shoulder, buttocks? And the answer is, according to Dr. Sarno, this is what Dr. Sarno says. Dr. Sarno says, many of us grow up, and in our family of origins, we learn at a certain level that, you know, gee, to survive in this family, it's not okay to feel certain emotions, particularly anger or anxiety. And so Sarno says, you know, most of us obviously grow up and we get out on our own, and Sarno says life's going to elicit anger or anxiety. And he says as those emotions start to come up from the body, a certain part of our brain, of our unconscious mind says, wait, it's not okay to feel those things. What kept you safe growing up and during your childhood was not feeling and expressing the anger and anxiety. So what Sarno said is that the brain will cause the muscles to clamp down and tense up, to cause a pain, to take your mind off what you're angry or anxious about. My personal belief is a slight difference from that. I think that people learn in their family of origin it's not okay to feel certain emotions, particularly anger, anxiety. As those emotions start to come up later on in life, the brain says it's not okay to feel those things. And I think the brain causes the muscles to clamp down to hold those emotions in the body so they don't come up to conscious awareness. Either way, though, the muscles are tension spastic. And by getting in touch with what those issues are and working with them with a modality like EFT or faster EFT or regression-based hypnosis or something, you can clear the emotional issues at a deep enough level that you get a physiologic shift. Now, by the way, guys, I have a little bit of a pet peeve I got to share with you. My pet peeve is this. There's a large percentage of people out there, maybe some of you watching this video, who love the idea of concepts. You know, I'm very So I used to be super intellectual. The term I use for it is super mental. No, I don't mean mentally ill. I mean, I hear my chair slipping. I mean, I just enjoy kind of the mental faculty and thinking about stuff and being really quick and things like that. That's good. But there's a lot of people who are interested in intellectual topics and in concepts and in not going that next step and saying, I wonder how this applies to me. So what I would encourage you to do, especially if you're a patient watching this, or if you're a physician or a life coach or a therapist, instead of just saying, the stuff Robbins is saying may or may not make sense, go to that next level and say, how does this apply to me? How does this apply to my patients? If I have back pain and the next time I have a migraine headache, how can I apply this to me to actually get a physical healing? Okay. Let me see what else I wanted to talk about here. So I'll give you a few more case reports today of things that I find particularly useful in my practice. One principle that I found extremely useful is this: that if somebody has an injury or some sort of accident or physical trauma, and then there's also kind of some unresolved emotional issues on that event, frequently it's very difficult for the physical problem or physical pain to heal unless you clear the emotional charge. And I'll give you a few examples of that. I remember years ago we were actually teaching a class on EFT at my hospital, and I was co-teaching it or sponsoring Loretta Sparks, who's an EFT master, and she's a good friend, great gal. Anyway, one of our own physical therapists came in, and she had a neck brace on, and the problem is she had some sort of whiplash from an injury 8 or 9 months before, and her neck was still hurting months later. And she was a physical therapist. So she'd been through all the physical therapy and ultrasounds and massage and heating packs and this and that. The pain was still there. So I said, I want you to focus on your neck pain as we tap these certain acupressure points. We were doing standard EFT at the time. Some of the time, about 30 or 40% of the time, if someone focuses on their pain and you tap these acupuncture meridians, the physical pain will get better. I had her do that, and she tapped, and the physical pain did not get better. So I asked Loretta, what's going on? And Loretta said, Eric, have her think back to the time when she initially injured her neck and see if there's any unresolved emotional charge on that event. So that's what I had her do. I said, when you think back to your skiing accident, is there any unresolved emotional charge? And this woman started crying and sobbing, and I mean, the tears were flowing, and I'm thinking, what's going on, Anyway, it turns out for her what the significance was that she was skiing and she ran into a tree. And what she last remembered is kind of the expressions on her kids' faces when they saw her hit the tree, because they thought mom was dead or something like that. And her kids were so upset by that, and that was causing an emotional intensity of like 10 out of 10 in her as she was recounting that story. So I said, feel those feelings that you get from imagining your kids' expressions. We did some EFT and tapped these acupressure points and cleared all the emotional charge off that event. When we started, she could feel it in her body. It was an emotional intensity of 10 out of 10. When we were done tapping, it had emotional intensity of 0. And then I said, now focus on your neck pain. We tapped these acupressure meridians again. Her neck pain disappeared that night. I saw her 3 or 4 months later. She said the pain was still gone. The neck brace was gone. You have to clear the emotions off past traumatic events. I had another woman who came to me. She was actually a nurse, and she had given birth at an outside hospital, not mine. She was actually a labor and delivery nurse, and her own delivery was kind of not really marred with complications, but marred with a lot of pain. I guess she had some sort of breech birth where the baby's head was in the wrong position, and as she was getting ready to give birth, the doctor had to put his hands inside and do some painful procedure to try and shift the position of the baby, and it hurt, and then the nurses were not understanding, and some of the nurses were bitches to her, and anyway, she was really upset by the whole thing around giving birth and then giving birth. Anyway, so for 6 or 7 months after giving birth, she had severe urethral pain and burning every time she'd try and urinate. Now, I want to digress for a minute and tell you an interesting story. I first heard this story from Tony Robbins that's going to come back and make some sense. Tony Robbins told the story that during World War II, the Japanese during World War II, there were a lot of uninhabited, uncharted islands in the Pacific Ocean. And the Japanese put some of their men on the islands with the gun and the bayonet. They said, stay here and protect the island. If you see any enemies, kill them. So the problem was that there were so many uncharted islands that after the World War II was over, the Japanese forgot where they had put some of their men. And sometimes it was months or years later before they were able to find and recoup all their men. In fact, I think the last guy was on an island by himself for 20 or 30 years before they finally came to reclaim him. So you can imagine it could have been 20 years after the war was over, and if you were an American guy and you went on that island, this guy would have shot you or stabbed you with his bayonet. He didn't realize the war was over. He's still trying to protect the island. Now, a lot of times, if something happens to our body, we tense up at the time. We tense up because emotions are too strong for us. And then even after the emotional event has passed, sometimes our mind and our unconscious mind thinks in terms of like how a 3 or 4-year-old would think. Like, for example, if a 3 or 4-year-old kid has a urine infection and it burns when the urine comes out, after 1 or 2 times of painful urination, that kid, at a very childlike way of thinking, says, it burns when the urine comes out. I better clamp down on that sphincter muscle to stop the urine from coming out, to stop it from hurting. The problem is that even after the infection's been treated, that kid unconsciously is still clamping down on that sphincter muscle because he thought that protected him. And sometimes days, weeks, months, or years later, the kid will still have persistent burning, not because the infection's there, but because the muscle's so tight that it's not letting the urine flow freely. In this labor and delivery, nurse's delivery, she had a lot of pain and a lot of emotional upset around the time of her own delivery. She had urethral pain and saw me months later for it. I said, think back to the time when you gave birth. We did EFT tapping to clear all the emotions off, all the traumas around that event. And then we just tapped on her to focus on relaxing her pelvic floor muscles, and all her urethral pain and burning went away. I had another kind of fun case. One of my partners was treating a guy who was like 35 years old for premature ejaculation. And he tried all the standard medical treatments for that, and nothing was helping. And he finally sent the guy to me. So this is the story the patient tells me, and then you could tell me how you manage it now that hopefully you're becoming a mind-body expert of your own. The patient recounts the story. He said before he got married, he was with many, many women, never had a problem with premature ejaculation. With the woman that he ended up marrying, they decided to not consummate the marriage until the honeymoon. So he waited till the honeymoon. He waited. He's very excited. On the honeymoon night, he released after a few strokes. Then the guy said something very important. He said that was so devastating to him. That's the word he used. Having that premature ejaculation on his honeymoon night was so devastating to him that he's never been able to forget it. So again, you have the start of a medical problem, premature ejaculation, associated with some unresolved emotional events. So I said, when you think about your honeymoon night, how intense are the emotions and where do you feel in your body? And he was able to tell me. I said, focus on that. We tapped these acupressure points using emotional freedom technique. We cleared all the emotional charge off that event. So a few minutes later, when you think about it, there was no emotional charge in the event. I had him focus on what he wanted, and we kind of did some tapping to kind of lock in how he wanted to perform sexually after that. And he called me a few days later and said, thanks. That's a urology joke, but it took care of the guy's premature ejaculation. So I can recount story after story after story. I'll recount one more brief story of this because I use this all the time in clinic, and it's a quickie. I had a 47-year-old guy who came to our hospital in urinary retention. He couldn't pee at all. They put a catheter in his bladder. He had about 1.5 quarts of urine in there, which is about 3 times more than you're supposed to have. They took the catheter. They eventually took the catheter out. We had him on medications to shrink his prostate, although he was a little on the young side to even be having prostate blockage issues. He came in to see me. He was still having a lot of urinary problems. A weak stream. He had a strain. He could barely get it to come out. We had him urinate. We checked his bladder, and he was still only emptying his bladder about halfway. So when I first walked in the room to see him for the first time, his wife goes, Robbins, whatever you do, I hope you don't have to touch his penis because of the horrible thing that happened to him at age 5. Again, guys, what would you do? I said, what happened at age 5? And so apparently I knew he had some sort of trauma. Something happened down there. Something probably hurt him down there. his muscles were still trying to protect him from the pain that he had back there, just like these soldiers from World War II. So the guy recounted the story that at age 5 he'd had a urinary tract infection, and as we sometimes do when kids have UTIs, we needed to get an x-ray of his bladder. So the doctors at that time took a very small tube, put it up the urethra to the bladder, filled the bladder with dye, took some x-rays, this and that. It's obviously not a comfortable procedure, but again, he still had a huge emotional charge on that event 42 years later. And I think that his sphincter muscle was clamping down to try and protect him from the pain that he had way back then. Again, guys, this is a common theme. We see it all the time. I said, when you think about that event at age 5, how intense are the emotions and where do you feel them in your body, he could notice that. Once we were done with tapping these acupressure meridians using EFT or fasterEFT, we cleared all the emotional charge out of his body. When you think back to that event at age 5, it felt the same to him like when he thought about brushing his teeth at night. It was completely emotionally neutral. After that, he started urinating fine. I saw him back a month later. He said, the problem's resolved. This lifelong problem I've had is resolved. The urine flows freely. We checked his bladder. He was emptying perfectly. And as they say, the rest is history. So, extremely common theme. And again, guys, listen to what I'm saying. Enjoy the intellectual part of it. And I want you, if you can, to start noticing, how does this apply to me? You know, I think the biggest, one of the biggest challenges a lot of people have, they hear this stuff, but they do not say, how does this apply to me? Or they think to themselves, well, this doesn't apply to me. It just applies to everyone else. This applies to you. All right. Enough for part 1 of this Mind Body series, guys. I will be at the upcoming Faster EFT seminar in Oklahoma City. It's February 27th through March 2nd, 2012. Like I said, that's just kind of one of my favorite healing modalities now. I'm using it in clinic. I'm listening to Robert's Ultimate training set on DVD and absolutely loving this. Robert worked on one of my relatives that had bad fibromyalgia and just changed this person's life, and I'm so thankful. So, in fact, it was interesting. One last aside: I saw a woman today. She was having a lot of bladder pain, pelvic pain issues, and had a number of issues in her life, and has been in therapy for a couple of years, and has been taking an Effexor, which is an antidepressant, for a couple of years. And I talked to her about her issue. Used faster EFT to clear a number of her issues. By the way, guys, one of the neat things that I like about faster EFT, I mentioned before, for non-therapists like me, it kind of teaches you an approach as far as how to do therapy, how to think about the client's problems. One thing we do, as you've heard me expound several times in this video, is we clear the emotional charge off past traumas. That's key. Because where these traumas are held in the body, like we talked about, it takes a tremendous amount of energy to hold those memories inside. That uses up a huge amount of the body's energy. So if you have chronic fatigue, you have to go back and clear the emotional charge of every past event. The other neat thing that Robert Smith does that I like is that he kind of steps back. He steps way back, notices the events in your life, notices the emotional patterns or common emotional themes that someone has, and that's kind of like that analogy of do you pull the guys out of the river, or do you look upstream and notice the higher level problem, which is the crazy guy throwing people off the bridge into the river. Robert's really good at backing up, looking at the higher level problem, and when you address things from these higher logical levels, you get tremendous healing changes. People's whole nervous system shifts. I actually had a private session with Robert a couple days ago, and it was life-changing. So this is Eric Robbins signing off, and I hope you enjoyed this video, and God bless.